Welcome to the Mindful Return podcast. I'm Kelly Tuttle, a retired neurology nurse practitioner and brain injury survivor. Together, we'll explore practical tools and real stories to help you rebuild focus, confidence, and a meaningful life after a brain injury. Hello and welcome back. In this episode, I'm going to be talking about one of my favorite subjects of brain injury, and that is sound sensitivity. I totally have sound sensitivity. It is awful. It's like the worst superhero power ever. It's definitely not what you would want. But it is something that can happen after a brain injury. It is common after brain injury, and that's why I want to talk about it to you guys today. Before my brain injury, I used to be able to work in very chaotic environments with noises and alarms going off all around me, and I could easily focus on the job that I needed to do. It was very easy for me to block out a conversation and read or work or chart on my patients. But after my brain injury, I was like, why is everyone talking so loud? And why can I hear that conversation so well outside my office when I never really noticed it before? Well, at the time, I didn't know that I was suffering from sound sensitivity and something also known as sound overload. So sound sensitivity can be a persistent symptom after a brain injury. It can be either just a little bothersome or it can be overwhelming, and it can actually make your brain shut down for some people. Sound sensitivity can make you feel irritable, tired, and make it really difficult to concentrate. After experiencing a brain injury, your sound processing systems in your brain may malfunction, causing sounds to seem louder. Sound sensitivity, also known as hyperacusis, is when everyday sounds seem loud and cause discomfort and, in some people, pain. How do you know if you have sound sensitivity? Like I said at the beginning of this episode, I had no idea I had sound sensitivity. I just noticed extra conversations. And then I also noticed that when I was driving to work, I couldn't have music on anymore because it was making me tired and giving me headaches. And looking back, I realized, oh, it's because I had this sound sensitivity. So thinking about yourself and your own recovery, how would you answer these questions? Do you find concentrating on work or reading hard if people are talking around you? Do you feel anxious or irritable when you go to places with TVs or music playing in the background? Is it hard for you to hear or focus on a conversation if a TV is on or if other people are talking with each other around you? Do you find yourself exhausted after hanging out with your friends at a bar or a restaurant? Do you feel anxious or get a headache while hanging out with several friends at a party or a get-together? Can you tolerate music playing in your car while you're driving? Do everyday sounds sound loud to you and bother you, but not anybody else around you? Do you ever wonder why people are talking so loud around you? My sound sensitivity so made me grumpy when I was at work. It was like ridiculous. I'd be sitting there working and I would get irritable hearing my coworkers typing on their keyboards. Oh my gosh, that's like the lightest sound normally that no one would ever notice. But to me, it was like pounding. I'm like, why are they pounding on their keyboards? It made me so grumpy. I wanted to grab their keyboard and slap them aside the head with that keyboard. It was ridiculous. So yeah, it could be a lot. It could be a lot, especially if you work in an open workspace. If you have sound sensitivity, it can be overwhelming and a challenge to focus on your work and concentrate and, basically keep your sanity. Other things that you may notice is you might find it challenging to read, think, and make decisions when people or noises are nearby. As a result, you may want to avoid social gatherings and miss out on activities you once enjoyed because the noise just becomes too overwhelming. So since my car accident, before my car accident, I would go to musical concerts and shows. And since my car accident, I haven't been to one. Yeah, it's crazy. One of the things that can happen after a concussion or a brain injury is that your brain may struggle to prioritize the sounds around you. Normally, it would automatically filter out background noises, allowing you to focus on a conversation with a friend sitting across from you at a cafe table. However, after your brain injury, your brain might treat all sounds equally, making it difficult to hear and understand your friend while you're having a cup of coffee together. Speech therapists call this hearing overload. Understandably, a lot of people don't recognize they have sound sensitivity or hearing overload, as it often is confused with feelings of anxiety, headaches, dizziness, difficulty with concentration, and irritability in everyday situations. So if you think you have sound sensitivity, what do? Especially if you're having a hard time concentrating at work, if you work in an open workspace and there's a lot of normal office noises going on around you that are distracting you. And what I found, I actually learned from a behavioral optometrist, was to use active noise counseling technology. And so when what you do is you look at your favorite electronic store and you look for active noise counseling headphones or earbuds. And what these do is they actively create a noise to combat the noise, a gentle noise in your ears to block the environmental noises occurring around you. And then the headphones themselves, or the earplugs, also provide passive noise blocking because they're covering your ears. And I mean, when I found out how to treat my sound sensitivity, it was like a serious game changer. I could actually, which is weird, I could walk straighter and I could focus longer. I had more energy at the end of the day. I could think better. I could read longer. I could learn longer. It was a huge, huge difference. With my sound sensitivity, I actually needed at work to sometimes double up on my noise counseling technology. So I would actually wear active noise counseling earbuds, and then I would wear my active noise counseling headphones over those earbuds to block out the sound, especially if I was having a really bad brain day, where I may have had a headache or I didn't sleep well the night before. Then I would really have to double up on the technology. And initially, I was able to get some earbuds that were really awesome, where they were made by Bose, but they don't make them anymore. But some of these noise counseling technologies, you can increase the noise counseling levels. So you can put it down super low so you can hear what's going on in the environment without having to take them off. And you could crank it back up if, say, you're working at your desk and then two coworkers start having a conversation behind you. So that is really cool. And then there was even one set of earbuds that actually was able to focus the trajectory of the microphone. So if I wanted to talk to someone in a really loud restaurant, I could put the setting on and it would focus on the person's voice and then block the rest of the noise away. And that was really cool. But I haven't seen anything like that before. So currently I just have earbuds and headphones that I can adjust the levels with while I'm wearing them. And then the ones I used were Bluetooth compatible. And so I was able to pipe in concentration music or classical music or something like that to kind of just give that extra blurring of the background noises on some days when I was having a rough time. I did try using passive noise blocking tools like earmuffs and earplugs, but for me, they didn't work because I felt like it made my voice louder in my head. And that was the last thing I needed when my brain was so sensitive as it was recovering. So some people do use those. They find them effective. So you could also try that, a low tech option. But I did discover ear loops. So ear loops as in LOPS. And these are pretty cool little passive noise filtering device because it goes in your ear, but it has an opening. And so you don't get that closed in muffled kind of sound when you're talking with them in, and you can adjust the vent to that opening. And I've talked to other brain injury survivors who really, really like those a lot. They're also nice because you can hardly see if you're wearing them. And again, they're low tech, so you don't have to worry if they're charged up and so forth. If you're wondering if you might have sound sensitivity, there is a tool that you can find on the internet. It's called a modified CAFA Hyperacusis questionnaire, and that's CAFA, KHALFA, and you can check that out. And if you're interested in this information and the specialists to see for any of your brain injury symptoms, just a reminder, I have that all in my book, After the Crush, How to Keep Your Job, Stay in School, and Live Life After a Brain Injury. And it is available on my website and usually any place that you buy your books. And it's available on Audible for any of you out there having a hard time reading books. So one of the specialists you can see to get screened for sound sensitivity is an audiologist. And they can do a test called uncomfortable loudness level test. And then they can definitely help you recognize if that's what you have for your sound sensitivity. Now, I will caution, when you pick an audiologist, you want to pick one that specializes in brain injury and brain injury issues to the hearing processes that can occur after a brain injury. If you don't, they're out there, they're pretty specialized, but they can look for other issues that might be happening and provide you with the tools to help manage it. I saw just a general audiologist, and I was glad that I got the test done, but I didn't like her recommendations. Hers was to do the desensitization to sound, and I get there is controversy regarding desensitization. I can't say it today. I can't say it today. I'm sorry, people. But it's controversial because, it helps some people, but not others. And my aversion to it was I was barely hanging on when I went back to work. And I was exhausted. I had horrible headaches and dizziness and irritability and just difficulty with concentration and focus. I was just dying. I just felt like I was dying. And to have someone say, don't use noise canceling technology because you need to get used to a loud world, when I was in that position so early in my recovery, that was not helpful to me. I needed tools to help manage my sound sensitivity because I was barely making it through the day. I needed to be able to drive an hour plus to work, put in an 8-hour plus day of work, and drive another hour home safely without falling asleep. And so manage my sound sensitivity helped me manage my neurofatigue. And if you've listened to any of my other podcasts or read my Substack, you'll learn that I discovered I had neurofatigue the hard way by falling asleep at the wheel while driving home from work. So it was not helpful to be told to, do this desensitization, forget it, I can't say that word, treatment. But that's okay. I didn't listen to her recommendations, which was helpful for me. But over time, as my neurofatigue became less as I got better at managing my brain injury symptoms. As some of them faded away or became less, I had more brain energy to filter out sounds. And I got to the point where I was using noise canceling technology at home because I had younger kids and, to be able to watch TV with the family. It was always so much louder for me than everyone else. And so I would wear my earbuds while I was at home whenever I needed to work or concentrate, or if I wanted to enjoy the TV program with my family. But after about 2 to 3 years, I was needing to use them less and less and less. And I don't even use noise counseling technology when I'm at home. And when I was at the time only using it at work, and because I just, the intensity of knowledge demand of my position at the time just wasn't compatible with working in an open workspace where people were walking around and talking and having meetings next to my desk while I'm trying to chart and write prescriptions for my patients. So it was really rough. But now that I work for myself, I'm at home most of the time, and I hardly ever use my noise canceling technology at all now. And on rare occasions, maybe if someone's watching TV and I'm in another room and I'm trying to, write for my Substack or create content for my podcast episodes, the TV's going or people are talking, I might put them on. But really, it is rare that I use it now, 10 years out from my brain injury. But I do use it still, like for travel, like especially airports. Use it a little bit because you do want to hear the announcements at airports. But when you're on the plane, I don't know if you've noticed that those jet engines are so loud, and other people are able to sit there comfortably and filter that out. So you can see my dog. But I am not able to do that. And that's just like pounding drums on my head when I'm on the plane. And then I can't even hear whoever I'm on the plane with, what they're saying. And so my noise canceling headphones definitely helped me with that. But yeah, things did get better over time. But until then, you can consider these tools, either the active counseling technology or the passive noise counseling technology, and help support your brain as it's trying to recover and continue to work and perform every day for you. Well, I hope that this helps. I hope you find this information helpful. And if you like what you're hearing, please like and subscribe and follow the Mindful Return. And until the next episode, take care, get better, get stronger. You've been listening to the Mindful Return podcast with me, Kelly Tuttle. Subscribe wherever you listen and head to kellytuttle.org for brain injury recovery tools, free resources, and inspiration to help you return to work with confidence and hope.